All right, now we want to bring you the latest on the deadly measles outbreak in Texas. Officials said Wednesday an unvaccinated child died of the highly contagious respiratory infection. The disease is entirely preventable thanks to a vaccine that's been around for more than 60 years. But this is the first measles death in the U.S. in nearly 10 years. Health and Human Services Secretary Robert F. Kennedy Jr. downplayed the outbreak yesterday. Listen to this.
We're watching it. We put out a post on it yesterday, and we're going to continue to follow it. Incidentally, there have been 4 measles outbreaks this year. In this country last year, there were 16. So it's not unusual. We have measles outbreaks every year.
Secretary saying it's not unusual. Omar Villafranca now joins us from Lubbock, Texas, where you've been covering the fear among parents and how heartbreaking this news is. What do we know about the child who died because of this outbreak?
Well, not so much, Errol, because there are patient privacy laws. But what they can't tell us, as we mentioned, is a child. The child was unvaccinated, and the child was school age. Now, the state of Texas breaks down cases by age. There's 0 to 4 years old and 4 to 17. So we know it was a child, and we know that child was 17 and under. But when it comes to exact, where did they live? Were they a member of that Mennonite community in Gaines County? They just cannot legally give out that information. We'd have to get it from the family, and they're not speaking out.
Now, thankfully, though, when it comes to news viewers can use, you spoke with the chief medical officer at the hospital where the child was treated, and you specifically pressed her on how young these kids are and they can't get vaccinated yet. But what did she tell you about the overall response to this outbreak?
Well, the hospital is really responsible for a large coverage area. I mean, we were in West Texas. We were in Lubbock. An hour and a half away is where this outbreak started. They cover, excuse me, a roughly 300-mile radius. So people are used to driving an hour or an hour and a half or two to come to this hospital because of the treatment and the care and the level of care that they can get. So they're seeing a wide swath of people coming in. And we played HHS Secretary Robert F. Kennedy Jr. sat there. I asked her about, he's saying that people are quarantined, that's why they are hospitalized. And she says, no, that is not correct. The people who are hospitalized here are all unvaccinated, and they are getting respiratory treatment, extra oxygen, helping them breathe. They're not here to quarantine. Quarantine is something that people do at home, and she wanted to make that clear since it seemed that the HHS secretary was sort of downplaying the hospitalizations here. But keep in mind, they're doing a lot to try to educate people about measles, and this is what she had to say about the measles virus and their reaction.
Measles is one of the most contagious viruses that we know of. So if you think about, 90% of susceptible patients will contract the measles if they're exposed. We only admit patients who need to stay in the hospital because they need acute treatment that we can only provide in the hospital. We only want to admit those patients in the hospital who really need to be there.
And Errol, this is also affecting how they're caring for patients. So in their emergency room where people may walk in, they've set out almost like a screening hub outside because they don't want somebody with the measles to walk into a general population area and possibly spread it. So they're screening people outside. And if they're coming in for measles, of course, they want to do the proper thing, not only for the people inside getting care, but for the doctors and nurses as well to make sure they're not exposed.
Yeah, so highly contagious. Omar Villafranca in Lubbock, Texas for us this morning. We appreciate your reporting. Thanks, Omar.